for our entire portfolio, we know how our drugs work. We know that they have this potential. We know they're safe. There's a lot of work we need to transform that historical anecdotal evidence into modern FDA compliant, FDA structured rigorous science. But different than any other biotech company.
Hey everybody, welcome back. I'm here today with Christian Angermayer. He's the founder of Atai Life Sciences, trades on Nasdaq under the symbol ATAI. Christian, welcome.
Hi, nice to be on your show.
You bet. Christian, Atai Life Sciences, what's the business?
So we're a mental health company developing novel drugs, and some of them are what everybody loves, so-called psychedelic drugs, but we're developing drugs to cure, hopefully, various mental health diseases like anxiety, addiction, post-traumatic stress disorder, and depression.
Yeah, well, I certainly have consumed my fair share of psychedelics, and I credit it for my sunny disposition and general state of mental health.
Okay,
so
it's two of us, so needs one to know one. So we're two very happy people.
Sounds like there's a night under the stars in our future. How did you come to start this company, and where are you based?
So I'm based in London. I'm originally German, which maybe my accent tells you. And actually, I did start the company after my first psychedelic trip in 2014, which I did. It's always the sort of important backstory. I'm not a druggy guy at all. I was actually the opposite. Although I come from Bavaria, where alcohol is sort of our daily nutrition. I have never, ever in my whole life drank any form of alcohol, never smoked a cigarette, never took cocaine, never did anything. I was always because I was always very happy, and I think I'm not dumb. So I was like, I think I have the perfect equilibrium, so don't rock the boat. And then there's a long story, because actually over a year, several friends suddenly, this was like between 2013 and 14, told me about psychedelics like magic mushrooms, ketamine, MDMA, whatever. And I was like, nah, that's not for me. But they showed me actually that back in the last century, some of these psychedelic drugs had actually been used as a medical drug in hospitals. That's very important for the treatment of various mental health issues. I was reading it. I do invest a lot in biotech, so that's my background. So I was reading and I was like, nah, I don't need it. And then suddenly there was this one day I was with my best friends in the Caribbean. It was the right place. It was a country where it's legal, which is also important. So I did it, short version, and it was hands down the single most meaningful, empowering, positive thing I've ever done in my whole life, full stop. Like nothing.
This was mushrooms?
This was mushrooms, yeah. So, and the next day I came out of it, and I'm an entrepreneur, yeah, so that's how I tick. And I was like, holy shit, if it's doing this amount of positivity to me as a healthy and happy person, I can totally see how this is curing mental health, or has the potential to cure mental health issues. And I was the beginning of the journey. And then it took me 2 years, because I was like, okay, how do I do that? And by the way, there was nothing. So I'm very, very proud, because it's such a important topic for me, is that in this millennia, in this century, again, there was a lot of things done in the last century, but in this century, we, my colleagues and I, were the first one ever to rediscover that. So we started at Atai Life Sciences, and so as of today, we started in 2017. As of today, we have, I would say, every single psychedelic drug which makes medically and commercially sense. Yeah, because there are some which are cool but don't make sense. You can't get IP around it, or there is no use case in the medical world. But everything which makes commercially and medically sense, I believe we have on our platform. And because unfortunately mental health is such a big problem, I would say it's most likely the biggest problem of our time in healthcare. More than 1 billion people are suffering. Yeah, so we also added, additionally to the psychedelic drugs, we added some non-psychedelic mental health drugs, because there is not a single silver bullet. Yeah, so you need a broad tool set to hopefully cure the crisis.
Sure. Sure. Okay. So you guys have programs running with Psilocybin, Arketamine, Ibogaine, Norigaine,
And
and some other things that
yeah,
I've never heard of. So can you tell me about, like, for example, dimethyltryptamine? I'm familiar with MDMA. I remember with fondness. What is Deu-Etifoxine?
okay. I happy to explain that. I think there's one more, and I don't know how much time we have, which is so important, especially in America, by the way, which is Ibogaine, because you also like, I don't know if you know Ibogaine, yeah, but
Sure.
like
Well, I've heard that a lot of people suffer heart problems when they do that.
no, okay. So first of all, I come to that in a second. Like Ibogaine is one of maybe the only drug we know which has the potential, again, because why I'm saying that, because we are about to prove it once and for all, yeah, to cure addiction up to heroin and opioid addiction, which is the big problem of the American system, or one of the really big problems, the opioid crisis. So, and one Ibogaine trip really has the potential to get people completely off that sort of terrible addiction. So, yes, there are a few, not a lot, like a few reported cases where people have heart problems. Yeah, but this is why, and I want to emphasize it also for the other drugs. Yeah, this is why all of our medical drugs we're developing at the moment, except maybe Arketamine, which could be used or could potentially be approved for at home use. But all of the other medical drugs we have are meant to be taken with a doctor. Yeah. And we believe that, yeah, especially also with our formulation and with the right sort of setting with a doctor next to you, yeah, the potential, and I would actually think it's a low risk. And by the way, in medical things, it's also a lot about what is sort of more important. Like, and if you are heroin addict, the likelihood that you're dying from the addiction is actually pretty high somewhere. So having maybe a 1 in 100 heart issue, there are many other drugs where the doctor has to say, look, which risk do I want to take? But additionally, we actually believe that with the right formulation, with the right setting, we can actually mitigate that risk. Yeah.
Sure.
So, and I think in our portfolio, Ibogaine is one of the most important drugs because of the severity of the problem. Yeah.
Hmm.
So then deuterated etifoxine, that's another good example. So it's a non-psychedelic mental health drug. And it's actually an older form of it is used in France already since a while. And that shows what actually, and this is one of, I think, the most important thing to know for an investor. The amazing thing about Atai is that all of our drugs, the psychedelic ones, obviously, because they're used since partly thousands of years, and then some of them were, as I said, medically available in the last century, but also the non-psychedelic drugs. So both groups have either prior medical use somewhere in the world, like etifoxine in France, or psilocybin in Europe and Switzerland. So we, in a simplified version, I can say we know they work, we know they save because they were used somewhere, yeah, and we just need to recreate these sort of old medical information, or sometimes it's more anecdotal information. For example, Ibogaine. There are Ibogaine clinics in Mexico, yeah, and other parts of Latin America where people with heroin addiction go and are helped. So we see very positively how Ibogaine works. I would call it anecdotal information because obviously this is not a double-blinded, broad study. But again, either for historical reasons and or for anecdotal reasons, for our entire portfolio, we know how our drugs work. We know that they have this potential. We know they save. There's a lot of work we need to do, need to transform that historical anecdotal evidence into modern FDA compliant, FDA structured, rigorous science. But different than any other biotech company, yeah, or many other biotech companies, yeah, I don't see, as the founder with all the buyers I have, I don't see that big downside surprise risk, what you normally have if you do a novel oncology drug. It can turn out it doesn't work. Yeah, this is the risk of biotech. We don't have that here. So you have a downside protected approach, but you have the full upside of actually a very broadly diversified company. Yeah, we have more than 10 drug programs in development, tackling the biggest problem of our time.
Well, that's incredible. You did one heck of an IPO, $225 million. That's just incredible. So I guess that's a demonstration of the support you have from the investment community in Europe. Do you think that the atmosphere for developing these novel types of approaches using formerly Schedule I drugs is more, is the landscape better for that in Europe relative to North America, in your opinion?
No, by the way, so we are a European company. This is where we started, but practically we're a global company. So we have big parts of our science and our operations are actually in the US. And we did our IPO in the US. So the money you just mentioned, we raised IPOing on Nasdaq, as you said. So it is a very global company, both global from our operations and global from our investors.
Well, fantastic. Christian, we're going to leave it there for now. I'm thrilled to hear about what you're doing because it's something I believe in essentially and fundamentally. So I would like to talk to you continuously over the development of the company, and I hope to meet you in person soon someday. Thank you so much for your time today.
Thanks for having me, and would love to come again.
You bet. Bye for now.